2020 has been a difficult year for everyone working in health and social care. At Ambient, many of the people we support are some of the most clinically vulnerable and susceptible to serious health complications or even death if they contract COVID-19. This may be because of their age or their underlying health conditions. You have worked hard this year following all the government guidance to keep both our staff and the people we support safe. There is lots of information and misinformation on the internet, in newspapers, social media and on the television about the virus and the vaccine. We want to ensure Ambient Support staff are kept fully informed with advice supported by the highest quality scientific evidence. Getting a vaccination against COVID-19 is the best way to protect not just the people we support but your colleagues and your loved ones. This short film aims to answer some of your most frequently asked questions.
Is the COVID vaccine being rushed through with no controls?
Any coronavirus vaccine that is approved will go through all the clinical trials and safety checks all other licensed medicines go through. The UK has some of the highest safety standards in the world. A vaccine will only be used if it's approved by the Medicines and Healthcare Products Regulatory Agency, MHRA. The MHRA has been monitoring every stage of coronavirus vaccine development.
Why are vaccines important?
Vaccination is the most important thing we can do to protect ourselves against ill health. They prevent up to 3 million deaths worldwide every year. Since vaccines were introduced in the UK, diseases like smallpox, polio and tetanus that used to kill or disable millions of people are either gone or seen very rarely. Other diseases like measles and diphtheria have been reduced by up to 99.9% since their vaccines were introduced.
How do vaccines work?
Vaccines teach your immune system how to create antibodies that protect you from diseases. It's much safer for your immune system to learn this through vaccination than by catching the diseases and treating them. Once your immune system knows how to fight a disease, it can often protect for months or even years to come. Having a vaccine also benefits your whole community through herd immunity. If enough people are vaccinated, it's harder for the disease to spread to those people who cannot have vaccines. For example, people who are ill or have a weakened immune system. We don't yet know if COVID-19 vaccines will provide long-term protection. Additional research is needed to answer this question. However, data suggests that most people who recover from COVID-19 develop an immune response that provides at least some protection against reinfection. We are still learning how strong this protection is and how long it lasts.
Who will get the vaccine first?
The government has said the vaccine will be offered to people who are most at risk from coronavirus before being offered more widely. This means it will first be offered to people who live in care homes and care home workers, people aged 80 and over, and health and social care workers in England. Most COVID-19 vaccines being tested now are using 2-dose regimens, and you will need to have the jabs over the course of a few weeks.
Will there be side effects to the vaccine?
Most of the side effects of vaccination are mild and do not last long. The most common side effect of vaccination is that the area where the needle goes in looks red, swollen, and feels a bit sore for 2 to 3 days. So far, thousands of people have been given a coronavirus vaccine, and no serious side effects or complications have been reported. Getting vaccinated will help us stop the virus in its tracks. Scientific evidence supports the safety of the COVID vaccinations currently available. Getting the jab will help us all get back to a more normal way of living as quickly as possible. Getting the COVID vaccination is the best way to protect the people we support, your colleagues, and your families and loved ones.